No more bladder cancer. Bladder cancer is a common cancer in Hong Kong, with an average of about 400 new cases each year. Male patients are significantly more common than female patients, with a ratio of about 3 to 1. It is common in people aged 55 to 70. If bladder cancer is discovered in the early stages, the cure rate is very high, but it is particularly prone to recurrence, so people who have had bladder cancer should follow up regularly. The bladder is a hollow sac-like organ that is responsible for collecting and storing urine. It is located behind the pubic bone in the pelvic cavity. Bladder cancer occurs when the cell tissue of the bladder lining becomes diseased. Most bladder tumors are like small mushrooms and first appear on the surface of the bladder lining. They are called papillary tumors. After a period of time, they will spread to the muscle wall of the bladder and other parts of the body. Who is at a higher risk of getting the disease? 1. Smokers. Smokers are 2 to 3 times more likely to develop bladder cancer than non-smokers. 2. People who are frequently exposed to chemicals. People who are frequently exposed to chemical raw materials, such as chemicals from dye factories, rubber, leather, paint, printing, petroleum and other organic chemical industries, are more likely to develop bladder cancer. Frequent use of hair dyes may also increase the risk of disease. 3. People who often suffer from cystitis. People who often have bladder infections or cystitis also have an increased risk of bladder cancer. 4. A direct relative has had bladder cancer. 5. Male. How to prevent bladder cancer. Reduce smoking and avoid secondhand smoke. Eat less pickled or preservative-containing foods. Drink more water every day. Eat more fruits and green leafy vegetables. Avoid exposure to dyes and organic solvents. People working in the textile, hair dye, leather, chemical, agricultural, and printing industries should take protective measures such as wearing gloves, masks, rain boots, etc. when working, and undergo regular health checks. What symptoms indicate bladder cancer? Some symptoms of bladder cancer are similar to those of cystitis, bladder stones, or kidney stones. The most common symptom is blood in the urine, which may not be painful and may occur intermittently at first. In severe cases, blood clots will form, causing bladder swelling and pain and urinary obstruction. If the tumor erodes the neck of the bladder, the patient may experience frequent urination, difficulty urinating, and a feeling of obstruction.